Every year, about 12,000 people in the U.S. suffer an injury to their spinal cord. Most of these injuries are the result of motor vehicle crashes, falls, acts of violence, or sports-related activities. Hopefully, you or a loved one won't have this type of injury. But if it happens, our rehabilitation center has treated thousands of people with spinal cord injuries. Our focus is to help patients return to the highest level of functioning possible. A sudden blow to the spine fractures or dislocates vertebrae, which can result in damage to spinal cord tissue. When the nerve cells and tracts of the spinal cord are damaged, messages that normally travel back and forth between the brain and other body systems are affected. The result can be a complete or partial loss of sensation, strength, and other bodily functions. In all cases, spinal cord injuries are serious and require immediate emergency care, as well as specialized treatment and rehabilitation. The first thing to do is to call 911. It is also critical not to move someone who has an injury to their head, neck, or back. Moving them could worsen the neurological impairment and reduce the chances for effective rehabilitation. It's important to remember that anyone who has significant trauma to their head, neck, or back needs immediate medical evaluation for the possibility of a spinal cord injury. The signs and symptoms of a spinal cord injury after an accident include pain or pressure in the head, neck, or back, as well as weakness or numbness in the arms or legs. The best defense is prevention. It's also important to keep in mind that the average age of people with spinal cord injury is rising. Older adults are more likely to have a spinal cord injury due to falling down. This is a national trend because the baby boomer generation is aging. Also, narrowing of the spinal canal occurs naturally with age. Unfortunately, these age-related changes make the spinal cord more prone to injury from relatively minor trauma, such as falling down in the bathroom. People with spinal cord injuries are typically taken to an emergency department and then to an intensive care unit. The first priorities are to stabilize blood pressure and respiratory function, as well as to stabilize the spine itself to prevent further neurological damage. Rehabilitation should begin as soon as possible after initial critical care treatment. Our rehabilitation center treats all types and levels of spinal cord injury, as well as traumatic brain injury. We have been evaluated and licensed by the Commission on Accreditation for Rehabilitation Facilities. This independent international organization helps make sure the quality of services and programs meet or exceed national standards. Each individual should have a personalized rehabilitation care plan developed for his or her goals and situation. The care plan is supported by a team of rehab nurses, physical, occupational, speech, and recreational therapists, psychologists, case managers, and social workers. The team works with our physicians to achieve the best outcome for each patient. At Santa Clara Valley Medical Center, we incorporate new treatments and innovative rehabilitation therapies into the care we provide patients with spinal cord injury. With a team of highly skilled and experienced professionals, we help patients reach the highest level of functioning possible so they can return to leading productive and independent lives.